Thank you, Mathew John, sir, for the great opportunity given to me. And this will be a topic which will be discussed in endocrine side, and it will discuss the safety and efficacy of dietary supplements for diabetes. So outline, we will touch on the definition, current concepts, classification of these drugs, what is the regulatory aspects, and the safety and efficacy of individual agents, and the logical conclusion of this topic. So what is dietary supplement? Dietary supplement is a product intended to supplement the diet. It is taken by mouth. It contains one or more key ingredients, including vitamins, minerals, herbs, amino acids, or certain other substances, and is labeled as being a dietary supplement. This is the official definition from the Complementary and Alternative Medicine website. It's also been termed as food supplements, nutraceuticals, therapeutic goods, and also herbal medicines. These are used interchangeably, but the standard definition is dietary supplement. So what is the logic of dietary supplement? I wanted to make it a very simple graphic. So this is the reason why people usually are inclined to start dietary supplement. It is summarized by ABCD. They wish additional glucose lowering in addition to the traditional medications. Second, maybe a belief that being natural means there is no risk with that. The third one may be that the cost will be the concern because the medicines were expensive, but I have found that dietary supplements are also equally expensive when taken in a barrage. The fourth one and the key one may be a desire or the pressure influence from the family and friends. However, we should remember that there are potential of adverse effects, drug interaction, and toxicity. And many of the supplements don't have a regulatory oversight because many of the guidelines are very flimsy, and usually Indian guidelines and the pharmaceutical pharmacopoeia are very liberal in these aspects. So the recognition that they fall under the rubric of complementary and alternative medicine, they are increased worldwide. The supplementary market has gone and the demand and changes are very high. So practitioners must be aware of the dietary supplement safety and how they are efficacious to advise their patients on appropriate use. The regulation, we have seen FDA is the key regulatory authority worldwide and USA. And now the US approach has changed and it's gone into the Dietary Supplement Health Education Act of 1994. So under this act, the manufacturer is responsible for ensuring that the supplement is safe before marketing that drug. So as you know, the term which has been popularly used for this is nutraceuticals. These are wider definition and they also include a pharmaceutical grade products, but without going through the regulatory approval that pharmaceuticals must go through. So the mushrooming of many agents is because they have a general promise that they provide benefits beyond their many basic nutritional value. So I am not touching upon the medical nutritional therapy, which is a different item because I was told that the topic has a wider notation, but because we have got dietitians and physicians, everyone, just to show you that this is a different entity and it is description by prescription only. So what do you know about effectiveness of these agents? Results from the survey show that 30 to 70% of adult people with diabetes use them as an alternative medicine, and 1/3 of them specifically use them to improve the diabetes-related symptoms. For few medications like supplements, there is a very weak evidence of possible benefit. For example, we have known that chromium may help in the blood sugar control. Alpha-lipoic acid may be helpful for diabetic neuropathy, but to conclude, they may not be the one which is evidence-proof, and evidence-based medicine or modern medicine may criticize them for this regard. So what do you know about the safety of these drugs? US FDA has warned consumers about using products about diabetes as claiming as natural diabetes cure, and these products are marketed illegally, but we should mention that they should not replace the standard treatment care for diabetes with unproven health product or practice because some of the supplements have side effects and these include kidney damage. The relevance of the discussion, there are inconsistencies on the reconciliation. There are individuals who don't disclose to them records, and there are many difficulty in recording this information as well. As a study showed that only 6% of supplement users were asked, disclosed, and had documented. So this brings to us why endocrinologist is important. We have devised a beautiful wellness science scheme, which includes endocrinology awareness for a healthy India. We have devised this because under the leadership of Dr. Kalra sir, because we want to make sure that our public is also aware of various scientific aspects of our endocrine subject. So another topic is immunity. Immunity may be the one which is critical to prevent the infections to cross over to our body. There are innate immunity and adaptive immunity beyond the scope of this topic. Just to show you that these agents may proclaim them to have an effect on the immunity, which is the natural defense against infections. The first one is the vitamins. Vitamins, the entire world in the middle of COVID pandemic, they are known to have an immune function and they have a good tolerability. The free radical scavenging activity of vitamins make them useful for using in general care and daily practice. The key pathophysiology of all these drugs is to reduce the oxidative stress. Oxidative stress is important in development of endothelial dysfunction, insulin resistance, diabetes, and the cardiovascular effects of diabetes. Antioxidants may help to improve the endothelial function and improve the glycemic control and the markers of cardiovascular death. How they do this? This is the way in which diabetes and hypertension have an activation of the pathways, and we can see that the onset of glycemic damage can be disastrous because oxidative stress, inflammation, and all can go into the macro and macrovascular diseases. Antioxidants are classified into minerals, vitamins, bioactive agents, functional foods. Just to show you that the commonly used antioxidants include the zinc, selenium, chromium, and the vitamins. The basic ones are the A and B and C and E. We are also seeing the bioactive forms like carotenoids and flavonoids. They are like natural fruits in the fruits, but the one is that they should not extracted once in the capsule or the tablet form. Also includes functional foods like green tea and ginseng. So vitamin B is the one which is usually described as an essential one. Its general role in energy metabolism, cell growth, and cell communication. They are no doubt the one which should be used in every diet. And most of our diet contains every vitamin, but deficiencies of vitamins are important because they can cause micronutrient impairment. Vitamin C is a randomized control study showed that 500 mg taken twice daily alleviates the inflammatory status by reducing the inflammatory stress response in hypertensive and diabetic obese patients. Generally, there is no conclusive proof, but a recent publication of 2017 included 22 studies with a good population size showed that when patients take them more than 30 days, there was a reasonable benefit in the glycemic control. Vitamin D, of course, there is a lot of vitamin D interest in the subject in the COVID era, but to show you the slide, here is an immunomodulatory mechanism. Lot of scientists, lot of trials are ongoing and have completed. This just to show you that there is a very systematic review and analysis of vitamin D in the nutritional practice because these have a role on insulin resistance and diabetes. This is the one which I want to show you, the outcome of type 2 diabetes. There is only one study which was showing the hazard was there, that is the Tromso study. All the other studies were showing beneficial outcomes, and we can see even metabolic syndrome, there was a benefit in vitamin D. Insulin resistance also, the hazard risk was very beneficial, that is less than 1 and near 0.8. This shows you that vitamin D may be the cause or maybe an effect of diabetes control as well. So this is not a very solid proof to recommend them for every diabetic patient. Next, coming to vitamin E. Vitamin E is actually referring to the family of 8 compounds. Alpha tocopherol is the most active among them. More than 90% of Americans do not meet the requirement. Antioxidant property of vitamin D is to boost and protects the cell membrane and anti-apoptotic action to enhance the immune function. Vitamin E is important because the diabetic population can progress to fatty liver. The daily recommended dose is 15 mg, but you can see the meta-analysis have shown that vitamin E role done up to 400 mg and 800 mg per day has shown that endothelial function was significantly improved by using them in non-obese type 2 diabetic patient, and also showing that synthetic vitamin E is less bioavailable than naturally occurring vitamin E from food. This graphic I'm showing you to show that the role of metformin is also helped by the use of vitamin E, because vitamin E addresses the second hit and reduces the oxidative stress and boosts the immune function in the long run. So next, coming to alpha lipoic acid, a critical cofactor. It is an antioxidant drug which has been used in our diabetic patients. It may reduce the fasting glucose level insulin sensitivity, but does not significantly lower the A1C values. The tried in patients is in diabetic neuropathy at a dose of 600 to 1800 milligram per day. the patients have to take for at least 3 to 5 weeks. Only 2 studies with population size up to 205 patients that was definitely shown to improve the symptoms of diabetic neuropathy. And to sum up, again, 235 patients over a long time, 2 years of study, did not prevent the progression of macular edema. And placebo-controlled study showed that there was a significant improvement in the insulin-mediated glucose uptake by increasing the sensitivity. For safety purpose, it is not shown to benefit type 1 diabetes. In addition, there may be a decrease in effectiveness of thyroid hormone, but when taken for long duration, they may have small side effects like GI upset, mild rash and headache, but usually it is well tolerated. Next, coming to berberine, there is another study on berberine as a dose of 0.9 to 1.5 gram. Meta-analysis showed that a small improvement in HbA1c by 0.7% was attained when compared to lifestyle alone, but definitely there are risks for use in pregnant women, and there are also potential for affecting the other enzymes metabolized by the liver. Chromium is one which is used in many centers. It's an essential trace element. A 2014 review of 25 studies showed that chromium may be useful in lowering the HbA1c by up to 0.6%, and FDA and Institute of Medicine suggest that it is safe when taken 200 mg per day for up to 6 months. By safety profile, it is largely safe, but few case reports have shown renal and liver injury with chromium, but long-term side effects have not been investigated. Coming to the most popular agent is the zinc. Zinc improves the immune function. It fastens the wound healing. It also delays the age-related macular degeneration. This is a study which used with single factor co-supplements just to show you that they are all protective in nature. And on the side, you can see the glycemic control here, showing that as a good value, it can also be used in a proper manner in glycemic control as well. So generally, my friend, this is the one agent which can be used in our general practice as an immunological agent. Magnesium is also found in many fruits and cereals. Magnesium deficiency may increase the risk of developing diabetes. The studies are very small, but we can see that they're not conclusive as well. Large dose of magnesium can cause diarrhea and abdominal cramps, and more than 5,000 mg, that is 5 grams, can be very deadly as well. Magnesium intake, ADA recommends that we use in a very liberal manner, but definitely higher intake may definitely reduce the diabetes incidence, but we can see that the dose should be as high as 2 grams. So omega-3 fatty acids, another popular among the nutraceuticals. Fish and other foods contain them. Taking the omega-3 fatty acids and glycemic control, there are some very conflicting results. US and Europe scientists found that fish eaters have high incidence of diabetes, but it is contradicted by the Asian and Australian population. But there is no strong evidence differences. The safety profile is generally safe. The mild side effects like bad breath, indigestion can be avoided in the long run. Selenium is another agent which is used in immune boosting. It helps to prevent the Cushing-Beck disease or cardiomyopathy, also prevents the cancer and heart diseases in diabetic patient or non-diabetic patient. It is protective against fungal and microbial infection. It is getting relief in rheumatoid arthritis, gout, eczema. Of course, the caution is that we should avoid excess selenium, which is also toxic for the body. Antioxidants in a nutshell can be summarized in this graphic. The more the natural, the ones contained in the food are having highest the antioxidant property, and we can see the defense mechanism is established. Large populations studies have been done on vitamin C, vitamin D, vitamin E. I'm just showing you in one slide that these are all effective in the common practice. Coming to the last section, it is the herbs. This is a graphic which I am showing you of RSSTI guideline, showing that many herbs are used in Indian population, believing them to be having effect. But some drugs like them used in practice are cassia cinnamon is used, but definitely they are not used in long run. That the common variety of cinnamon may be having a good property. Curcumin is one agent which has been popularized in even COVID time as an anti-inflammatory property. Long-term data is also lacking, but however, it's found to be safe and having less effects. And this is the mechanism of action, just to show you that there is a reduction of the anti-inflammation and reduction of antioxidative property, as also the anti-apoptotic effect. This is the studies which are published on curcumin. Next, coming to fenugreek, it's also used in our practice. We can see uluva is the one which has been mentioned. These are also our patients use as a home remedy. There are many forms of powder, seeds, and capsules. It's potentially uterine stimulant, so you should avoid in pregnant women. It can produce an effect in HbA1c in a meta-analysis of 10 studies, but this is not a uniform across trials. Flaxseed is also another popular agent used to improve the insulin resistance. The greatest is seen with whole flaxseed than flaxseed oil. Safety profile, it causes bloating and flatulence and also causes potentially estrogenic effects. Herbal supplements, there is no reliable evidence that they can control diabetes or complications, no benefits of cinnamon, other agents, and no conclusive of any herbal supplements in general practice. This is a summary, and this slide I am just showing you in detail because all the discussed points are there in one table, summarizing that the efficacy and safety of these agents are yet to be established and determined. So other supplements, we are not sure about antioxidant property in tea, coffee, wine, fruits, grains, because these are all used in our general practice. Whether this should be used in nutraceuticals is also in preliminary stage only. Nephrotoxic is one thing which you should remember because this is the most prevalent cause of causing reversible and irreversible side effects on the kidney. And year in review of endocrine disorders focused on nutraceuticals because this is a gaining in legitimacy and popularity. These are also growing interest in also metabolic syndrome, obesity, and osteoporosis. This is the graphic, which is a unifying concept in diabetes. I would urge you to put enough more time on this. Metabolic diseases, diabetes, we are actually promoting lifestyle habits in the initial stages. Endothelial dysfunction can be prevented by using proper lifestyle measures as well. Antioxidant property of these agents of nutraceuticals can definitely help the patients to go into, prevent them from going into complications and protecting against oxidative stress. So concluding remark from my side, with growing popularity of publics, it is not good that we automatically dismiss them as having no role in the modern evidence-based practice. We should critically weigh the evidence for each compound as I have done, just like any drug. The studies discussed here are reasonably good quality. They are only showing a short-term treatment benefit. We should definitely promote them in our research prospect. So this is the one which I am summarizing. There's various agents being used. And this is just to show you that when given in synergy, they may have a better effect than given in a single agent alone. So I thank you everybody for the kind listening. I will be open to discussion. I am thanking my department for also helping me in promoting research, Sri Gokulam Medical College, located in a rural center in Trivandrum, Veñaramuda. You can follow me on Twitter. I am available on @Monty_doc. Thank you everybody for the kind listening. I was a bit fast because there is a time constraint of 12 minutes. I will be open to any discussion later on. Thank you everybody.